This is normal and abnormal cervix, which I was talking. So by this you can know what is this abnormal cervix, how it looks, and how the abnormal cervix you looks. In the first few rows, you will see this whitening of this cervical lesions, which you can consider this as an abnormal thing when we put acetic acid inside that. So this is one. In the next row, you can see there is some reddish lesions here and growth here, which is also looks abnormal. In the third slide also, you can see mix of white and reddish lesions, which looks abnormal. In the fourth slide, you can see the different reddish color discoloration of the cervix, and there's such bleedings also, which bleeds on touch also during the pap smear test. So in that case also, it will be like looking like a abnormal cervix. Then comes the last side. You can see some white color growth here. It could be the fibroid or any kind of polyp, which is abnormal. Next. So we will know the different types of cervical lesions. The cervical lesions can be that malignant and non-malignant lesion, or benign and the neoplastic ones. So most common category goes with this inflammatory, reactive and reparative lesions, which we see very commonly, like chronic cervicitis and papillary endocervicitis, and some cells as coilocytic changes and follicular cervicitis. There is certain hyperplasia, or there's a growth. Hyperplasia, excessive growth of the endocervical gland into the extracervical part. This is called Nabothian cyst, diffuse laminar endocervical glandular hyperplasia, tunnel clusters, and microglandular hyperplasia. Then comes the metaplasia and ectopians, squamous metaplasia and tuboendometrial metaplasia, and other benign lesions like endocervical polyp or leomatous polyp. Next. So usually, commonly, we will be talking about this cervical erosion, which is quite common. So cervical erosion or ectopian, it is always a confusing word. We can take it as a similar thing, similar changes, which occurs when the eversion of the endocervix, and which exposes the columnar epithelium of the internal layer to the vaginal milieu. The cervical ectopian affects people whose bodies are producing usually the high levels of estrogens, like in adolescence, pregnancy, which is a normal physiological changes. Also, the cervical ectopian occurs in abnormal cases also, but the normal cases or the physiological cases like adolescence, pregnancy, and during the ovulation phase of the menstrual cycle, you may find this is a normal change. Next. So as you see how the cervical erosion looks in the colposcope, you can see this reddish, which is going out from the internal os, from this external os. Sorry, this is the external os, and from here, these reddish lesions are cervical ectopian or ectopy or erosion. So when we do a pap smear through this, when we touch this, there is a chance of bleeding also. So this is a diagram which shows how the lower part of the cervix, how the inside layer of this lining, which is coming out. You can see the lining is up to internal layer. This is a glandular layer, which is up to here. In the next picture, you can see how it has grown outside. So then it causes ectopia. This is the enlarged picture, and you can see how it has grown out. Here it is the normal part. Next. So what are the symptoms and what is the management? In short, it usually leads to the vaginal discharge. Usually we see the woman complaining of the white discharge, and it is maybe excessive, or it may have smell, or it may be infected, and postcoital bleeding also. And management, usually when there is no infection, is reassurance, and we have to exclude other causes of infection. And if any infection is there, we can treat it by vaginal swab culture or by doing a cervical smear, and in case it is very excessive, we can go for coagulation therapy, that is called burning therapy. Next. There are certain that what we talked about is the benign lesions, and I would like to just highlight few other points before going to the pre-malignant lesions of the cervix. that Nabothian cyst which we see is also the same similar the non-benign. This is a benign condition where the outer the squamous epithelial cells usually covers the endocervical cells, and it forms a retention of water is there and forms a cyst. So usually people are afraid of Nabothian cyst, but these are the normal conditions in the cervical area which we see. Cervical polyp is not just a small growth from the cervical area which is due to the hyperplasia or the these columnar cells that grows excessively to form that growth. So these are also usually benign condition. We have seen many times cervical fibroids or the hard tissue also, which is like a normal uterine fibroid comes out through the cervical canal. So these are also the benign condition. So all the treatment of this endometrial polyp and cervical fibroid is mostly the coagulation and the surgery. Electrocautery we do to remove the surgery, to remove these tissues, and we send for the biopsies. Nabothian cyst usually doesn't have much of the treatment, only reassurance is needed. Sometimes coagulation therapy may affect the, this Nabothian cyst. So these are the few benign reasons which I spoke.